This is Chris Wright, and this is my low back scan video. First, we'll start with the obliques. Go ahead and cross your arms like this. Lean back 30 degrees. And resist. Strong. Turn right. Resist. Strong. That works your left external and your right external and left internal. We'll have patient turn to the left and resist. Okay, that works the left external and the right internal obliques. So go ahead and lay down on the table. Now we'll do the right quadratus lumborum. I'm going to push the patient's legs 10 degrees away from myself, stabilize on the left contralateral leg, and as the patient resists, I'm pulling the legs towards me. Resist. Okay, quadratus lumborum is strong. Now we're going to do the rectus femoris. Hold it right there. Resist. Strong. Iliacus. Foot's externally rotated. Resist. Good. This is going to be the psoas. Resist. Good. Sartorius. Okay, resist. Now you pull towards your shoulder. Pull toward your shoulder. Resist. Okay, that's strong. Sartorius. Adductors. We're going to be at the foot of the table. No, we're doing the gracilis. Okay, this is the gracilis. So we have one foot internal rotated, and as I pull the legs apart, the patient resists. Resist. Okay, good. Now for the adductors. I'm going to bring the right leg back to neutral with internal rotation. Pull it out as the patient resists. And resist. Does that pull out? Okay, good. That's strong. Now we're going to go to the glute medius. This is going to go off. Scoot to the right just a little bit. There you go. Internally rotate. And I'm going to pull it in and you resist. Okay, the strong glute medius. Then you have the tensor fasciae latae. Same thing, but with the leg up. So resist as I pull. Okay, that's strong. Now you can go face down. Now for the hamstrings. Hold it right there. I'm going to push down and resist. Resist. That's the hamstring group. With the lower leg internally rotated, toes externally rotated, working the lateral hamstring group. And resist. Rotated lateral, toes pointed medially. Resist. That's the medial hamstring. Then we have the piriformis muscle. Lower leg is medially rotated. As I pull towards me, the patient will resist. Good. Now for the glute maximus. Raise this leg up like this. Just like that. And now resist. Good. And now for the sacrospinalis muscle. I'm going to pull this down just a little bit. Sacrospinalis muscle. Okay, so what you're going to do is just rotate this shoulder back and down like that. Just leave it right there. Just like that. Okay, the patient's shoulder is back off the table and depress the ribs. As I come in here at a steep angle, I'm going to try to push the shoulder I to S, medial to lateral, inferior to superior. You resist? Good. Okay. Now, turn back over. Let's see if we can pull this. Okay, now for the lower leg muscles. For the tibialis anterior, we're going to have the patient invert the foot and dorsiflex and hold it right there. As I push lateral to medial, superior to inferior, and stabilize on the outside heel. Resist. Okay, good. Now we're doing the peroneus tertius. The patient has their foot everted and dorsiflexed. Stabilize on the medial heel. I'm going to push medial to lateral, I to S as the patient resists. Resist. Good. Okay, the tibialis posterior. Tibialis posterior. Patient has her foot plantar flexed and inverted. And I'm going to put a straight medial to lateral push while the patient resists. Resist. Okay, strong. And now for the last one, peroneus longus and brevis. Patient's foot is plantar flexed and everted. Stabilize on the medial heel, medial calcaneus, as I push straight lateral to medial. Resist. And that's strong. That concludes my low back scan.